If you or someone you know is suffering from acid reflux, hey, this session is super for you. And if you are following along our channel, our process here, you're just trying to lose weight, hey, stick around. The same physiology that is helping us suppress acid and open up some healing space in our digestive system are the same processes that help us digest our food, extract nutrients, and power our weight loss process. So a good digestive health situation, so essential for good health and every health process. So I hope that this session be very helpful for all of these things. We're diving in on GERD today. This is something that is so common. Gastroesophageal reflux disease. So is actually one of the most common ailments that people face in our modern world. So we're going to be diving into some deep thinking, hopefully, on it, and some research, and I'll give you my clinical perspective and experience. I have interacted with this process so much. So as we move forward with it, be happy to take your questions as we go, and especially can have a big discussion at the end. So a chronic digestive condition where stomach acid and other contents repeatedly flowing back up into the esophagus. So can irritate the esophagus, lead to acute and chronic discomfort. Very unpleasant situation. So classic symptoms: heartburn, all right? Might feel like burning, pain in the chest, up into the throat, can occur after meals, often plaguing people at night when they lie down. All right, so sour, liquid, even undigested food back up into here. Yeah, and then we have atypical symptoms or other symptoms. So reflux, considered one of the great mimicking diagnoses. So someone coming into the ER with chest pain is always on the differential diagnosis. Of course, they're always thinking heart attack, but sometimes the pain of reflux, can be right in here, and we can have to distinguish that. Other times can be just abdominal pain. People can experience this in different places. Difficulty swallowing or feeling like something is stuck in the throat. Sometimes we have acid irritating the back of the throat, and then it can feel like something is scraped or stuck, even if it's just inflammation from the lining of the esophagus and back of the throat getting burned, and other things. Cough is definitely on the differential for cough. Someone coming in, cough can be caused by many things, including reflux, nasty going all the way down and irritating the lungs. Someone presenting with a new onset of an asthma-like syndrome. So reflux, has got its hands all over the place, can be affecting a lot of things in our health. And amazingly is one of the most prevalent conditions that we face. Here's some data on this. Up to 28% of adults in North America struggling with GERD at some point during the year, not necessarily all the time. And North America leading the pack globally with this issue, unfortunately. Omeprazole, number 8 most prescribed drug, even though it's generic. I thought this was amazing. So you can go get a Prilosec at the pharmacy, and despite that, still the 8th most prescribed. For the PPI class, proton pump inhibitors, proton pump, this is what is creating the acid in the stomach. A proton pump inhibitor shut that down. And 100 million PPI scripts annually in the U.S., and which is just a huge number. When you realize that doesn't include all the generic use, which is probably bigger. I don't know, might even be bigger. This article that I referenced down there teases out some of the details. Crazy Horse is with us. Say, I suffer from reflux more than likely hiatal hernia. Yeah, so here's something definitely in the mix. The heavier I am, the worse it is. Just 20 pounds can make a huge difference. Yeah, feeling the pain under the sternum radiating down into the diaphragm. Hey, glad you're here. Thank you for sharing. Your experience is valued, and so I'm sure a lot of people can relate to it. There is a lot like this. We're going to get into this. So connecting the situation, weight loss, something that we are extremely interested in, going to help with this process. Many people experience that. So fasting giving us multiple mechanisms where we can get at this process, and I'm going to review these with you. So the common situations we have, there's risk of acid, and so I'm certainly not opposed to PPIs. I want people to be able to take as few medications as absolutely possible, but there's real benefit to these medicines, and so I'm certainly not telling anyone, you can just fast and stop it. Okay, there is a process to these things, because risk of acid is real, and acid is damaging the lining of the esophagus, and this can lead to a condition called Barrett esophagus. Which is a transformation of the type of cells in the esophagus actually kind of morphing themselves over into a more like a stomach cell, and then it doesn't belong that way, and that this can be a risk for esophageal cancer. So it's no joke. We want this situation to go away, and acid blockers can suppress that process and stop that process from happening. And so taking a medication for it, of course, if it is helping, needs to be a very prudent thing to do. On the other side of the coin, there is real risk of acid treatment too, and I think this is generally becoming more appreciated as time has gone on and evidence has accumulated of the risks of these things. So PPIs in general, omeprazole and all the related compounds, acid is a normal part of the physiology. It's not bad. The GI system is built to handle it, and it uses it for many purposes. The acid, of course, determining what the pH level is in the digestive system, and the pH, many nutrients are absorbed in a pH-dependent fashion. And so when we drop out the acid, we can end up with malabsorption of nutrients, especially calcium, magnesium, iron, and B12. And this can manifest not, in the short term, but long-term use of these things. If we are chronically depleting our calcium, there are warnings on these products about development of osteoporosis, absorption of magnesium, iron, and B12. You can end up with anemia from malabsorption of these things. And so these are real concerns. And then a litany of other issues can develop, including increased risk of infection. I put C. diff infection here. Non-antibiotic associated C. diff is associated with long-term PPI use. Also inflammatory bowel disease. And as I was diving in, I read a couple papers on this yesterday, and it's just very interesting to look into the medical literature and see people kind of blow that off, and they say, the incidence is only about 1 in 3,000, okay? And so it's kind of like this sort of motion. But to me, I'm like, there's 100 million scripts for these things being written, and this is a lot of people that are having trouble from it. So both acute and chronic kidney disease. So acute interstitial nephritis is associated with PPI use, and then CKD, chronic kidney disease. So there's just like a host of things, and even if some of these more serious things are small in their relative numbers, relative to the scripts, the absolute numbers are actually shockingly large. And so what we want to do, of course, everything I'm trying to do on the channel, how do we move toward health in a natural fashion, try to use every technological thing that we have at our disposal, but need it as little as possible. So I don't care if people invent every single better thing than a PPI with less risk. I would still want people to be thriving and healthy and not need it. And so that is what we are going to be trying to do. So here I just found this stock photo trying to overlay the digestive system. They needed to make it a little bit bigger, but we're getting the idea, okay? I want you to understand the anatomy of what is happening here. Stomach, it isn't symmetrical. It's not just a circle. And if you look, the stomach is starting off to the left side of the abdomen, and then it traverses over and enters into the bowel over on the right side of the abdomen. And so some of this physiology is like really helping us understand some practical things about how we can use a few simple practices to help mitigate our experience of reflux even before we dive into the fasting part of it. So if we lay this person down on their right side, do you see I put a little acid flask in here? So like little red flask full of acid when we're upright, okay? Everything draining down, gravity supporting us. But when we lay down over on our side, especially on our right side, see, I put the flask right up. Do you see the esophagus coming down, emptying into the stomach? That point right there, lower esophageal sphincter, this is the point where there's a muscle that'll tighten up and try to seal that off. But do you see that for part of the stomach, the acid can pool at that spot when we're right on our right side? And so if you have a hiatal hernia and the connection with the diaphragm and the sphincter diaphragm coming right through and supposed to support the lower esophageal sphincter right there, and hiatal hernia, that they aren't quite lined up anymore. And so then it can leak through. And so do you see, lying on the right side, if acid were pooling right there, then that would be something that could make it worse. Whereas if we flip over, you see, because the stomach is shifted to the left, that this is causing a natural sink and reservoir. And so people sleeping on the left side, often you can keep the acid from pushing up right against the lower esophageal sphincter like that. And the other thing, if we're trying to let gravity help, if we're just trying to minimize reflux as much as possible, let gravity help. Classic recommendations: put the head of the bed up, and then it is kind of draining down. So I'm trying to build out the foundation for us as we're seeing what are the things that are triggering reflux to happen. All right, there's relaxation of this sphincter is happening. If the sphincter function at the end of the esophagus was perfect, you say it is always sealing it off, and we couldn't really have reflux. And so the natural practices that we want to do, trying to help support that. So here's some historic medical advice as we're getting into it, especially as it relates to meals. How many people have been told something like this who are struggling with GERD? Eat small, frequent meals. And then, maybe 6 to 8 times a day you are eating. And so now we're going to head really into our eating, thinking. And, to be honest, this is like the standard advice that is given for almost every single digestive problem. Constipation and irritable bowel syndrome, inflammatory bowel disease. People are told, eat small, frequent meals. And I'll tell you, this caused a lot of trouble for people, actually. And, it's interesting how we got into this situation. The idea behind it is, when we aren't challenging the digestive system very much, we're just going to put a little bit, and then it can clear it out more quickly. And so you can kind of see the idea of the wisdom of it. And just in practice, what it ends up doing, you just end up running the GI system all the time, and we end up increasing the amount of acid that we have. And and then this would be part of it. Marie says, eat a lot of crackers, right? There's a lot of simple carbs coming in, and the thinking there is like, we're going to soak up the acid with these simple starches and help to clear it. And I'll tell you, everybody feel free to share what your experience has been and I've got a paper that looks at it too. You eat something, you can eat almost anything in the short term. There is an acid buffering effect, but the trouble with that is it also inspires the stomach, say, we're eating now, and it actually cranks out more acid. And it can be amazingly, unfortunately, a self-perpetuating problem. And then it's very hard to lose weight this way. This is also, this is like the standard advice of the medical system for almost everything. Historically, and thankfully that's changing. We'll look at some nice studies. Very hard to lose weight when you're eating all the time. Like, standard dietary advice, you want to lose weight, people say, well, eat small, frequent meals. And then, dieting becomes this process of eating little bits of food all the time, but never as much as you want. And so it's super unpleasant to go through, right? Because it's like we're never really satisfied. And I'll tell you, the human body, the digestive system is built and designed to handle meals. It's not designed, as best I can tell, in the physiology and the experience. It's not designed to have constant intake all the time. And this can be damaging to the system, actually. And then it's a way, absolutely, that we can gain weight. Never give the stomach a break. This is a huge issue. So, thankfully, people getting the idea, like, this isn't working very well. If we look at the data that we've reviewed, we say, okay, there is a huge problem here. And the dietary advice that we have certainly is not helping. So this study was done in Stanford, published in a major gastroenterology journal. 25 patients. This is a tiny study. 25 patients, and it's a 4-day observational study. For 2 days, they are eating their standard diet, which included no fasting. And then 2 days after the study, they did 16-8. Okay, and they eat 2 meals over the course of 8 hours. And then they do 2 things. They're self-rating their reflux symptoms, which just in 2 days, they had a 30% reduction in their reflux self-rated systems. And then they get a wire down, all right, an esophageal pH monitor, and they documented in these people an average of about 18% reduction in their total acid exposure. And so this is very fascinating. Now, of course, we can say, well, we want a giant randomized trial, and we want it to be 3 or 6 months or something longer than a couple days. But this is the type of thing that we have. And it's very interesting to see where some literature is going. The fact that we have been in the system for so long, telling people eat all the time is the answer. And now we got some top researchers, actually generating some clinical data. So I think the progression is very encouraging. Here's another study published in a family medicine journal that was done jointly in Pakistan and Saudi Arabia. And so it's very interesting. There's a doctor there. The name of this study, Akram's Lifestyle, the doctor there, Muhammad Akram, who I'm not familiar with, but they have less reflux overall in the Middle East, but still dealing with it. And this doctor's put together his lifestyle, which is basically just intermittent fasting, specifically for reflux. This is what is so interesting about it. So in patients coming to him for reflux, he's developed his whole system is just basically 14-10, eat 2 meals only, and then just water or some other liquids tolerated in between that. But it's just 2 meals a day. And so in this observational study, 60 patients, 2 weeks of 2 meals a day, and patients self-rating their reflux symptoms down nearly 70%. And then that increased as they got through the process. It was a cumulative benefit as they went through it. So from my perspective, I think there's 2 independent things that are happening there, and these are things that we need to look at. It was like the fasting interval. How long is someone fasting? That is having a suppressive effect, especially as we get into a routine with it. Not necessarily the first day, like we said, because, our digestive system operates on patterns. And, a line that I try to walk on the channel is to tell people, okay, we're not stuck in some rigid dogmatic process when we are fasting. Fasting can be very flexible. You can do it on some days and not others. But when we get into something like this and we realize, okay, acid production is one of these things that is hormonally regulated, and the brain and our little brain down in the digestive system trying to predict when we're going to be eating, and it will start priming the pumps on the acid generation starting even half an hour before we usually eat, so that the system is ready to handle it. And I found a study once that I read, and I wasn't able to find it yet for this talk, but it was looking at the impact of meal frequency on acid secretion. And when people are eating more frequently, we actually getting more pulses of acid happening. And so as we get in a schedule and bringing our routine down, and the body is starting to understand that we are eating at only these times, we actually are creating more acid-free space and decreasing the total amount of acid produced. And what they say in the studies, AET, acid exposure time, is actually reduced, giving the system a chance to rest and heal and recover. And so part of it is that, and then part of it is just the total, meal frequency itself, the mechanical trauma of like, okay, all this stuff is sliding through here, rubbing off the stomach lining. Do we have space to regenerate that? It's when that smooth mucus lining gets taken away, and then the acid can be burning right on there. In the perfect state, the body has kept that lining all intact, and the acid never actually touches the more delicate cells there. It's like when we give it time, it can regenerate that. Very positive. Okay, additional benefits of fasting. So food, like we said, buffering the stomach in the short term, but then it is triggering this, it's like more new acid is coming on top of it, actually. Like described in the literature as an acid pocket can form over it, which is actually, when it's on top, think of that stomach anatomy. We're putting a lot more acid close to that lower esophageal sphincter. And then this term, TLESR, transient lower esophageal sphincter relaxations, right? This is medical stuff. They abbreviate it like that so our papers are not so long. Things can trigger the lower sphincter to relax a bit, right? Or maybe you have a hiatal hernia, and so it is just happening. And when we are grazing, more perpetual food is coming in. We're constantly regenerating acid there. And then if that sphincter relaxes a bit, this is creating an environment where reflux can happen. But fasting is the opposite. When we let the system clear out, then the acid pumps are shutting off. The acid pocket is gone. If that sphincter relaxes a little bit, there's not going to be anything there, ideally, to trigger the symptoms. So fasting giving us a real physical benefit in that way. And then, okay, mechanical offloading, right? Especially during sleep. So it's like the big thing. So many acid protecting mechanisms diminishing during sleep. We're not swallowing so much. Like when we swallow, we're triggering contraction of the esophagus, kind of pushing everything, keeping it moving down here. Less saliva coming through. And then like we said at the beginning, gravity not helping to clear things out. And so if we eat something, solid food, 4 to 5 hours to fully get everything out of the stomach. And so especially fasting in the evening is extremely helpful for this. And it's very counterintuitive because a lot of times, tell me what your experience is like, we get the immediate reinforcement that we get. We have a sour stomach going on. We're experiencing some reflux. You drink something, you eat something, and you feel this temporary benefit. And you say just a little respite from it, thank God. And so that reinforces the idea that eating is helping us to make the reflux better. But then we kick in the acid pumps, we build that new acid pocket, and then it can be worse. And so, the cycle that can develop, you eat right before bed, but all of a sudden now we filled up the stomach, and now there's more contents pushing up that acid pocket, and then it can be pushing back on the sphincter. And then if our sphincter isn't perfect there, if we have a transient lower esophageal, relaxation event, okay, then it can help, or it can trigger reflux. You see, fasting in the evening, if we didn't eat for 4 to 5 hours before we went to bed and we lie down and the stomach is totally emptied, it can make such a profound difference to our reflux experience. Now, when I'm talking to people about when should someone fast, like my default and most people's default is to fast in the morning. Many benefits to fasting in the morning. People usually the least hungry. People usually have a cup of coffee and hang out, grab a simple fasting mug from Dr. Z, and then we just kind of chill and say, hey, I can float through this space pretty comfortably, and that is usually the easiest way to flow through some fasting space and have a lunch dinner. But I say optimizing this in a reflux space. Now, there is actually tremendous benefit also in fasting in the evening, also for weight loss. It's the more powerful time to do it. And so if you were to ask me, like, what is the more powerful fasting window for weight loss, to be eating a breakfast lunch or a lunch dinner, I'll tell you, it's more powerful to eat breakfast lunch and then fast in the evening. But people don't like to do it as much. Because dinner is our more social meal. And so I say the path of least resistance that keeps most social meals at their normal time is to fast in the morning. But if you are trying to heal reflux, then fasting in the evening has extra benefits to it because of this mechanical offloading that I'm saying. The longer you go before you go to bed, the more you're shutting down the stomach, the more you're offloading any pressure on that lower esophageal sphincter, and the less reflux symptoms you'll have. And so tightening from both ends and in fasting in the morning and fasting in the evening, increasing the total fasting time is going to be decreasing the total acid time and that acid exposure time, giving the body as much opportunity as it can to heal the digestive lining. This is the same physiology that brings healing for so many other digestive processes, like inflammatory bowel disorders, and we could go on and on about it. Giving the digestive system a chance to rest and heal is just so profoundly beneficial, and it's not something that we get very much, in our society. And then this is super synergistic with weight loss. So late eating is, of course, the optimal time to gain weight. To say, okay, I like to kind of personify some of this thinking. It's like, okay, we eat right before bed because we say, I want to soak up some acid. I'm getting the crackers in or anything like this. Well, let's just look at the first moments, okay? We ate the crackers, we felt better, it soaked up some acid, yes, and we forget for a moment that the body's just going to make more acid, and 20 minutes later we're going to still be struggling with it. Okay, but you just loaded, another 20 grams of carbs in there. And now the pancreas is going to be cranking out insulin, and so our insulin is going up. The body's still got to process this, and the body's like, okay, what do we do with this? It's like 10 o'clock, we're trying to sleep. Okay, we're trying to shut everything down. Now we're cranking the systems back on. Body's thinking they're going to be up all night. Got to run all the intestinal processes, everything we thankfully don't have to think about. Body's like, insulin is the message. Remember, insulin is a hormone, so you take extra blood sugar, jam it inside of body fat cells. This is the drive that insulin creates. This is why if you are developing or have type 2 diabetes and you get put on insulin, it's why it creates so much weight gain, because it's the signal molecule that says store body fat. And so the big thing we're trying to do in a weight loss space, both by controlling, our intake of carbohydrates to try to keep our insulin level low, and then open up some fasting space, and then bring in some gentle movement practices to burn up all the sugar so it doesn't have to be stored anywhere. Okay, we're undoing that with late eating, and the body is like, okay, we don't need this energy now. Hormones saying just tuck it away for later, except later comes and we still don't need it. And this is the sort of cycle. And so this sort of space, trying to get out of a cycle of late eating, is so good for reflux, so good for weight loss. And it's actually one of the spaces where there's total agreement and overlap between nutritionists that both support fasting broadly and those that don't, because you'll run into medical providers who don't like fasting, which hopefully is getting to be less and less over time as people understand, scholarly studies and the physiology. But any nutritionist you talk to, if you're suffering with reflux, will tell you, yeah, you should clear out the late eating. Now, they just don't call that fasting if they're not on board with it, but it's fasting, okay? And it has many benefits to it. And then if we're just in the weight loss space, any nutritionist, I've never met one who say, oh, like, eat more right before you go to bed. Nobody says that because it's totally clear to everybody. The physiology, it's like, that's optimal time to eat to gain weight. Okay, here's something to avoid, and this is something to avoid just with fasting in general, okay? Compensatory overeating. When you're talking to nutritionists who do not like fasting, it's because they have had experiences like this with people where some people, and there's a natural part to it. I was reading a study once that if you knock out a meal, on average, people who are not practiced, at least these studies, not actually studying people who are practicing fasting, they're just studying people who are told to not eat a meal, and then they look, people naturally eat about 20% more than they would at their next meal. So there is a natural tendency for compensatory increase in eating at the next meal after one meal is skipped. Now, when you are practicing these things, you say, I'm practicing fasting. You don't have to do it that way. And of course, the longer that someone has a fasting interval, going away from simple fasting and into extended fasting, of course, you have to be very thoughtful about easing into things, breaking the fast in a gentle sort of way. If you're doing simple fasting in a day, eating just 2 meals or 1 meal in a day, then we're not in that sort of zone. But it still is the case. And some people struggle with this. Let me know, is this something that you struggle with? I've talked to a lot of people. And sometimes fasting is not the right answer. I've said a lot of times lately, we're on a fasting channel, but I am not a believer that fasting is the perfect thing for every single person. And for someone who really struggles with this, say every time I try to do fasting can trigger a binge eating or something like that, say I want to stay far away from that. I say wouldn't do it. But that's something that can be approached very thoughtfully, very gently. I talk a lot about a fasting space as repairing or healing our relationship to food. And so that is a space where we could go. So that would be like a whole talk. But if we specifically look at compensatory overeating from an acid perspective, this is the exact opposite of what we're trying to do. We're trying to create spaces where we let the GI system clear out and we kind of put acid production in its space. And if we all of a sudden, if this triggers us to really overeat, all of a sudden we're really distending things, that can be a big trigger for, a worse reflux event is something we don't want. So just make sure you're being thoughtful with it. I didn't include these papers, but I reviewed some of it. There's 1 billion people on this planet practicing Ramadan fasting in the Islamic tradition. And so people have studied this a lot. They're oftentimes, eating before sunrise and then an evening meal after sundown. And most people, the literature in the Ramadan literature that I reviewed, is that reflux is actually much less doing that. That's this Akram's lifestyle sort of thing that they're studying in the Middle East. And but there's a subset in those papers of people who are having huge meals, at their late meal, and these people are having a lot more reflux. And so just recognize that. Remember, the whole thing that we were talking about is we're trying to avoid the late eating. And so Ramadan opening up an opportunity for people where have some late eating. And so it's then we have conflicting benefits. We have a bigger fasting space, maybe only 2 meals. But if we're putting a lot of eating late, that data is showing us, okay, that's not the time when you really want to be eating if you're trying to help with reflux, certainly. So stay far away from that. Okay, so a top recommendation from all of these things. Clearing out the late eating. This is just the top thing. It brings so many things together. It brings the physiology, both for weight loss. It brings the mechanical offloading. It is just helping everything. So wherever that is, and that can be flexible. If you're someone who has typically been eating before bed, to get that short-term effect. Just maybe this is like recognizing, okay, that physiology is not working very well for many different reasons. And so can you just start like leaning into it like we've been doing on the summer challenge for weight loss? Can we just lean in by slowly working that back? You know, you don't have to jump. If you've been eating at 10 o'clock, you don't have to jump all the way to 6 in one go and then you're sitting there. Here's a couple little tricks or tools to think about with it. One is if you're trying to soak up some acid and you're eating to do it, you know, using a calcium supplement, calcium carbonate, Tums, this sort of thing. Instead of eating, maybe there's a little sugar in some of that. Sometimes there's artificial sweeteners. I mean, I don't super like these things, but in the short term, to try to break a cycle and say, oh, I'm not going to be eating this, take a little calcium supplement, is like get you through, like that's a way to do it. And then just marching it back, recognize I probably had reflux for, if it's been an issue for a long time, say it doesn't have to be solved instantly. You know, look at the study in Pakistan by 2 weeks, it's just getting better and better. So just recognize the more we practice it, the more skill we get with it, the more we let the body adjust to it. And as we give it a little bit more time, getting stronger, more space to regenerate that lining. You know, if we have gastritis, you can think of like a pre-ulcer where it's like, okay, that nice protective lining has been thinned out and now the stomach is irritated. It hasn't ulcerated yet, but the acid is right on it. So give it more space, let that heal. That can take a couple weeks. And so that's what I say, just lean in. And I think of it like a dose response relationship. How much fasting space do we dial in that actually helps the reflux to be better, you know? And that can be different. We have different physiology. We're in a different space. So for some people, if you're not doing any fasting, maybe just opening up a little bit. Like look at the study that was showing even 14 hours. Don't even have to get all the way to 16-8, but getting in a routine with it. And by 2 weeks, people finding benefit. And, you know, part of that, I think, is going from 3 meals to 2 and knocking out all the snacks so that we're giving the body a chance to rest and actually have that healing space in there. That's a way to lean into it. And then the long-term benefit, the main thing that I want to point out with it is that the whole process then circles around into a second benefit, which is that especially the visceral fat, the abdominal fat, is increasing intra-abdominal pressure. Right? There's like more material in a smaller space, and that can be physically driving reflux in and of itself. And so as we use fasting, along with every other beautiful tool that we have, getting active in a thoughtful and enjoyable way, and then eating our healthiest low-carb foods, minimally processed foods, right? Weight loss is reversing that process. And so as we are losing weight and we're literally taking the pressure off inside of our abdominal cavity, and then that is like less pressure pushing up against the acid into the sphincter. And so very, very helpful. And so obviously there's going to be short-term benefits from mechanical offloading. And then this is a process, take a little bit, like Crazy Horse was saying, if they've dropped 20 pounds and then they can really feel it. And so this is the sort of thing, but you don't lose 20 pounds instantly. And so then that is the longer term benefit. And then these things can really start to cycle forward. That's what I want. So I just spend a little time tell you about my clinical observations. Fasting, I have said on the channel a lot. It came to me like a gift. I couldn't believe it the day it came. It was a total miracle where I saw a patient who had healing from type 2 diabetes. And I just couldn't believe it. I was like, is this real? I've got to look into this. And I told the story. The wonderful Hindu woman just happened to be there at the same time, who is this master at fasting and done it for 40 years. And so amazing. So I started leaning into it mainly for diabetes, but then it became very clear that this is a profound space, because I start taking people on insulin. I help them to gently fast. I'm dose reducing their insulin to help them do it safely. Anybody who's in that situation needs significant clinical oversight, and I've written protocols to do this. And I'm going to do a talk soon on my paper, so I talk through all of that in a different session. But, you know, right away, within the first couple weeks, I'm like seeing people, blood pressure getting much better. I'm like, well, this is fascinating. And then people who've not been able to lose weight in the past, I'm seeing, okay, especially as we're getting the insulin out. I was describing earlier that insulin caused a lot of weight gain pressure, and so we start bringing the insulin down, blood pressure coming down, people able to finally lose weight. People can do it. I was thinking nobody's going to want to do this. That's what, because I was thinking I don't want to do it. I was never a faster. I ate 4 times a day, like all the time. And I just thought that that is like, if 3 is good, 4 is better, like more nutrition. Like this is like a standard sort of thing that is taught to people. Got to keep the metabolism going. And then I was going in a bad way with it. And all of a sudden I was like, I heard it. I saw it. I'm like, oh no, I'm going to have to do it. I was not looking forward to it. And then, but then I did it. And I was like, oh, like you can do it. I can do it. And then I started feeling better and it helped me. And then I was like, no, I'll tell people, look, you can do it. Let's do it. And then the more people start doing it, okay, it's like diseases that people think can't go away, all of a sudden going away. I'm like, this is wild. Not just like a magic wand, though, okay? It's not like, oh, you just fasted once and like, you know, it's like you're cured. No, this is a lifestyle like the guy's paper. We're trying to create a way of being in the world which is very physiologic. The reason I've gone through, okay, studies and anatomy and things is just to realize, okay, the body has ways that it's designed to work. I've said a lot on the channel, wouldn't it be nice when the baby comes out, instead of the placenta, it was like an instruction manual, and I just gave every perfect, piece of advice. And instead we have nothing, and we're all just trying to do our best and work with the body and learn. But my observation, for what it's worth, is, man, you start opening up some fasting space on a routine basis, really get into it, and a whole lot of benefit can come. And so this was kind of the order. I saw, okay, diabetes getting better, then blood pressure, people losing weight, and then next on the list was digestive problems, and acid being the big one, as we saw from the data, that so many PPI scripts, so many people struggling with this, and so much benefit can come from it. So it doesn't mean it's going to heal every sort of thing, or that this is the answer to every single thing. I'm not saying anything like that. But if you just look at the physiology, the bit of research that we have here, see, there's real reason to think that it could. And I say, why not try it? Why not gently lean into it and see, talk with your medical team. I'm internet guy. Look at all my disclaimers. I'm not telling anyone to do anything, but I'm just showing you the papers and the science that is out there. I'm sharing my clinical perspective. You talk with your medical team and see, is this the type of thing that might be able to lean into it and get some benefit? Lean in is the way to go with all of these things. Always gentle and gracious, always feeling in a perspective where, hey, this is nice, ideally. Or if we're finding a line, because fasting can be difficult, right? The experience of hunger is a barrier. And if you don't feel like never forcing through it, say, we're just going to find that line, and we say, okay, that's good enough for today. And that's the way I would always want people to appreciate it. Appreciate y'all being here with me. Love the conversation and the thoughts. Thank you for that. Really hope that people find this perspective to be beneficial. If you're here on the replay, if you're coming through to any time, or you're here with me live, come back to this session if you have further reflections and thoughts on it. Questions for ongoing discussion, put them in the comments. We have an ongoing discussion about it, just like we can do with any of topics on the channel. One step forward every day. That's what we're trying to do here on the channel. Take a step forward in health. Center our thinking. digestive health, such a key part of our well-being. We can take it so much for granted. You know, when everything is working well, we just eat something, we go on with our life, and the body takes care of stuff. And, you know, then we encounter a space like this, acid reflux, where it's like, man, this system not working so well. And then all of a sudden, can't it just consume like at least half of our thoughts, especially if you're struggling with it during the day, I know. And it's like you're trying to work and you got this going on. And so take a deep breath. Let's try to open up some space, see how much healing can happen from the fasting process. Let me know as time goes along. Do you lean into something like this? And does it help? Feel free to share. And then I know even I was getting emails from people yesterday. I leaned in specifically in this talk into the fasting part of it. There'd be a whole nother talk that we could do just about, you know, diet and food choices specifically. And when we are in our fasting window, like what exactly do we eat? Because of course there's many recommendations for food choices in reflux. And, you know, we can talk a lot about that too. Some people, of course, classically say, oh, got to get the spicy stuff out, and that can make a difference. Certainly, you know, there's a lot of conflicting information too. Peppermint, people say, oh, peppermint's so bad, but actually I found a study once, Mayo Clinic, I think, peppermint helpful for some people. And there's a supplement. I'm not too big on supplements, but there's a natural supplement, Iberogast, which is a whole bunch. It's made in Germany, I think. It's got a whole bunch of nice stuff in it, chamomile flowers and peppermint in it. And it helps a lot of GI discomfort. And so some people say, oh, Iberogast made my reflux worse, but I've definitely had some people say, oh, it helps so much, and they loved it. So there's all kinds of dietary things. Some people emailing and chatting in yesterday, oh, apple cider vinegar helping them. And so there's not a lot of research on some of this stuff, but if people have and want to share perspectives and things that have been helpful for them, of course, use the comments, support each other, share your experience is a beautiful thing to do. Thanks for being here. I look forward to connecting with you again soon. Have a great day, everybody.